troughs une petite piqûre. So 1, 2, 3, tuck. Sorry. Always pinch when you create the hole, and then the direction of the cannula is vertical. So you pinch and you go vertical, and you can just turn it like that, and we go deep, and then I will horizontal. So you need to feel there is no resistance with your non-dominant hand. If there is a resistance, you just go back and forth, that's it. I've passed the ligament here, and to really assess where is the tip of the cannula, you can just do this maneuver, and you can feel with your finger where is the exact position of the tip of the cannula. So I will start in the middle of this area, so it's just here, and then I will inject slowly. So for her, she has a big loss of volume because she lost some weight. So I will just inject everywhere and dip. Tout va bien?
Ouais.